Fundamentals of pharmacology, drugs and their binding sites.
1. Define the term drug receptor or drug target and discuss the functional significance of the interaction of drug with its receptor/target.
Answer.
A drug receptor, also known as a drug target, refers to a specific molecule within the body with which a drug interacts to produce its therapeutic effects or other biological responses. This interaction between a drug and its receptor/target is a fundamental concept in pharmacology and plays a crucial role in understanding the mechanisms of drug action. The functional significance of the interaction between a drug and its receptor/target is multifaceted and can be summarized as follows. 1. Specificity and selectivity. Drugs are designed to interact with specific receptors or targets in the body, often with high selectivity. This means that the drug's action is directed primarily towards its intended target, minimizing undesired effects on other molecules or systems. This specificity is essential to achieve the desired therapeutic effect while avoiding unnecessary side effects. 2. Therapeutic effect. The interaction between a drug and its receptor/target is responsible for initiating a series of biochemical and physiological responses that lead to the desired therapeutic effect. For example, a drug that targets receptors on heart muscle cells may increase the contractility of the heart, making it a useful treatment for heart failure. 3. Disease modification. Many drugs exert their effects by modulating the activity of receptors or targets involved in disease processes. By altering the functioning of these molecules, drugs can mitigate or even reverse the underlying causes of certain diseases, leading to disease modification rather than just symptom relief. 4. Cellular signaling. Receptors are often involved in cellular signaling pathways that regulate various processes within cells. When a drug binds to a receptor, it can activate or inhibit these signaling pathways, leading to changes in cell behavior, gene expression, and overall cellular function. 5. Homeostasis regulation. Some drugs target receptors involved in the body's homeostatic mechanisms. By interacting with these receptors, drugs can help restore the balance disrupted by a disease condition, thereby promoting overall health. 6. Altered physiology. Drugs can induce changes in physiological processes by interacting with receptors. For example, pain-relieving drugs often target receptors involved in pain perception, reducing the sensation of pain without addressing the underlying cause. 7. Side effects and adverse reactions. While the specificity of drug-receptor interactions aims to minimize off-target effects, interactions with unintended receptors or targets can still occur, leading to side effects or adverse reactions. Understanding these interactions is crucial for optimizing drug safety and efficacy. 8. Individual variation. Variations in the genetic makeup of individuals can lead to differences in the expression or structure of receptors/targets. This can result in varying responses to the same drug, a phenomenon known as pharmacogenetics. In summary, the interaction between a drug and its receptor/target is the cornerstone of pharmacological interventions. It underlies the therapeutic effects of drugs, their potential to modify disease processes, and their ability to restore balance within the body. A deep understanding of these interactions is essential for drug development, personalized medicine, and the advancement of medical science as a whole. 2. Discuss the roles that drug size, drug chemistry and structure, and drug stereochemistry play in influencing the interaction of drugs with their receptors. Answer. The interaction between drugs and their receptors is a complex process that is influenced by various factors, including drug size, drug chemistry and structure, and drug stereochemistry. These factors play crucial roles in determining the binding affinity, efficacy, and specificity of the drug-receptor interaction, ultimately affecting the drug's pharmacological effects and therapeutic potential. 1. Drug size. Drug size refers to the physical dimensions of a drug molecule. The size of a drug can influence its ability to fit into the binding site of the receptor. If a drug is too large, it might not be able to enter the binding site, preventing effective interaction. On the other hand, if a drug is too small, it might not provide enough contact points for a stable interaction. 2. Drug chemistry and structure. The chemical composition and three-dimensional structure of a drug significantly affect its interaction with receptors. Drug-receptor interactions are often based on complementary shapes and chemical properties. A drug molecule needs to have specific functional groups and chemical characteristics that allow it to bind to the receptor's binding site through various types of interactions, such as hydrogen bonding, electrostatic interactions, van der Waals forces, and hydrophobic interactions. Additionally, The overall structural arrangement of a drug molecule can determine its orientation within the receptor's binding site, affecting the strength and specificity of the interaction. Subtle changes in the drug's structure can lead to variations in its binding affinity and selectivity for different receptor subtypes.
3. Drug stereochemistry. Stereochemistry refers to the three-dimensional arrangement of atoms in a molecule.
Chirality, a specific aspect of stereochemistry, plays a significant role in drug-receptor interactions. Enantiomers are molecules that have the same chemical formula but are mirror images of each other, similar to left and right hands. Enantiomers can exhibit different interactions with receptors due to their distinct spatial arrangements. Receptors are often chiral themselves, and they can differentiate between enantiomers, leading to differences in potency, efficacy, and even side effects of a drug. This phenomenon is known as chiral selectivity and has led to the development of single enantiomer drugs to enhance therapeutic efficacy and reduce potential adverse effects. In summary, drug size, drug chemistry and structure, and drug stereochemistry collectively influence how drugs interact with their receptors. A well-designed drug molecule needs to possess appropriate size, chemical properties, and stereochemical arrangement to ensure a strong and selective binding to its target receptor. Understanding these factors is essential for drug design and optimization to achieve desired pharmacological effects while minimizing unwanted interactions and side effects. 3. Describe the different types of intramolecular forces that contribute towards the interaction of drugs with their receptors and their relative impact on the strength, specificity, and duration of the drug-receptor interaction.
Answer.
Intramolecular forces play a crucial role in the interaction of drugs with their receptors. These forces determine the strength, specificity, and duration of the drug-receptor interaction, ultimately influencing the drug's pharmacological effects. There are several types of intramolecular forces involved in this interaction. 1. Hydrogen bonding. Hydrogen bonding occurs when a hydrogen atom bonded to an electronegative atom, example oxygen, nitrogen, interacts with another electronegative atom. This force is relatively weak but highly specific.
Hydrogen bonding between a drug molecule and its receptor can contribute to strong binding and specificity.
It often involves interactions between functional groups such as hydroxyl, OH, amino, NH2, and carbonyl, C=O, groups.
2. Ionic interactions. Ionic interactions, also known as electrostatic interactions, involve the attraction between positively and negatively charged ions.
In the context of drug-receptor interactions, this can occur when charged groups in the drug molecule, such as ammonium or carboxylate groups, interact with oppositely charged residues on the receptor. Ionic interactions can contribute to strong binding but may also lack specificity due to the prevalence of charged groups in biological molecules. 3. Van der Waals forces. Van der Waals forces encompass London dispersion forces and dipole-dipole interactions. These forces arise due to temporary fluctuations in electron density, resulting in the formation of temporary dipoles. Despite being individually weak, the cumulative effect of van der Waals forces can contribute significantly to the overall binding affinity between a drug and its receptor. These forces are relatively nonspecific and can contribute to both the strength and duration of the interaction.
4. Hydrophobic interactions. Hydrophobic interactions occur due to the tendency of nonpolar molecules to aggregate in aqueous environments.
In drug-receptor interactions, hydrophobic regions of the drug molecule can interact with hydrophobic pockets or residues in the receptor. These interactions contribute to the overall stability of the drug-receptor complex.
Hydrophobic interactions are often important for the strength and stability of the interaction. 5. Pi-pi stacking. Pi-pi stacking involves interactions between aromatic rings of drug molecules and aromatic residues in the receptor. This interaction is important for compounds containing aromatic rings, and it contributes to the overall binding strength and specificity of the interaction. The relative impact of these intramolecular forces on the strength, specificity, and duration of the drug-receptor interaction can vary. Strength, hydrogen bonding, ionic interactions, and hydrophobic interactions tend to contribute more to the strength of the interaction. These forces can result in tighter binding between the drug and its receptor, leading to a higher affinity. Specificity, hydrogen bonding and pi-pi stacking often provide higher specificity because they rely on complementary arrangements of functional groups or aromatic rings. Ionic interactions and hydrophobic interactions can also contribute to specificity,
but they may exhibit more general interactions due to the prevalence of charged and nonpolar groups in biological molecules. Duration, van der Waals forces, hydrophobic interactions, and pi-pi stacking contribute to the stability of the drug receptor complex, thus influencing the duration of the interaction. Stronger interactions of these types can lead to a longer residence time of the drug within the receptor's binding site. In summary, the interplay of these different intramolecular forces determines the overall quality of the drug-receptor interaction in terms of binding strength, specificity, and duration. The optimal combination of these forces varies depending on the drug's chemical structure, the receptor's characteristics, and the desired pharmacological effects. Describe the fundamental differences between drugs that act as A. Agonists, B. Partial agonists, C. Neutral antagonists, D. Inverse agonists, E. Positive allosteric modulators, and F. Negative allosteric modulators. Answer. Agonists. Agonists are drugs that bind to a receptor and activate it, leading to a physiological response. They mimic the natural ligand's action on the receptor, essentially turning it on. Agonists can produce a full response from the receptor and are often used to enhance or mimic the effects of endogenous signaling molecules. B. Partial agonists. Partial agonists also bind to a receptor and activate it, but their activation is weaker compared to full agonists. They produce a submaximal response even when all receptors are occupied. Partial agonists can both activate and block the receptor's activity simultaneously, making them useful for situations where fine-tuned control is needed. C. Neutral antagonists. Neutral antagonists, also known as competitive antagonists, bind to the same receptor site as an agonist but do not activate the receptor themselves. Instead, they simply block the binding of other molecules, agonists or partial agonists, to the receptor. Neutral antagonists do not elicit any response on their own but prevent the natural ligand or agonist from binding and producing an effect. D. Inverse agonists. Inverse agonists are a bit unique compared to the others. They bind to the same receptor as agonists but produce the opposite effect. Instead of activating the receptor, they cause it to become less active than in its baseline state, constitutive activity. Inverse agonists are useful when the receptor is showing excessive baseline activity, and their action can lead to a decrease in that activity. E. Positive allosteric modulators. Positive allosteric modulators, PAMs, bind to a different site on the receptor than the primary binding site for the natural ligand. When a PAM binds, it enhances the receptor's response to the agonist by increasing its affinity or efficacy. Essentially, PAMs boost the receptor's sensitivity to the natural ligand without directly activating it. F. Negative allosteric modulators. Negative allosteric modulators, NAMs, also bind to a site different from the primary ligand binding site. However, their action is opposite to that of PAMs. NAMs decrease the receptor's response to the agonist, essentially reducing the receptor's sensitivity to the natural ligand's effects. In summary, these different types of drug actions provide various ways to manipulate receptor activity and signaling pathways, either by mimicking the natural ligand's effects, agonists and partial agonists, blocking those effects, neutral antagonists, producing opposite effects, inverse agonists, enhancing the receptor's sensitivity, PAMs, or reducing the sensitivity, NAMs. Each type of drug action can be tailored to achieve specific therapeutic goals. 5. Compare and contrast the different molecular mechanisms of actions of drugs that act as A. Agonists, B. Partial agonists, C. Neutral antagonists, D. Inverse agonists, E. Positive allosteric modulators, and F. Negative allosteric modulators. Answer. Agonists. Agonists bind to the active site of a receptor and activate it by stabilizing the active conformation of the receptor. This leads to a cascade of intracellular events that result in a physiological response. Agonists can either be endogenous ligands, naturally occurring in the body, or exogenous ligands, drugs. The binding of an agonist to its receptor can trigger a conformational change that initiates downstream signaling pathways, ultimately producing a cellular response. B. Partial agonists. Partial agonists also bind to the active site of a receptor, but their interaction is weaker compared to full agonists. They stabilize the active conformation of the receptor to a lesser extent. This results in a submaximal response, as not all receptors are fully activated even when all binding sites are occupied. Partial agonists can have intrinsic efficacy that is between that of full agonists and neutral antagonists. C. Neutral antagonists. Neutral antagonists, competitive antagonists, compete with agonists for binding to the active site of the receptor. They do not activate the receptor but instead block the binding of agonists, preventing their action.
Neutral antagonists and agonists both bind to the same site on the receptor, and the antagonist's binding effectively inhibits the agonist from binding and eliciting a response. D. Inverse agonists. Inverse agonists also bind to the same active site of the receptor, but they stabilize the inactive conformation of the receptor. This results in a decrease in the basal or constitutive activity of the receptor. Inverse agonists essentially turn off the receptor's activity, which can be beneficial in situations where the receptor is overactive even without the presence of an agonist. E. Positive allosteric modulators. Positive allosteric modulators, PAMs, bind to an allosteric site on the receptor, which is distinct from the primary agonist binding site. When a PAM binds, it induces a conformational change in the receptor that enhances the affinity or efficacy of the primary agonist. This amplifies the receptor's response to the natural ligand without directly activating the receptor itself. F. Negative allosteric modulators. Negative allosteric modulators, NAMs, also bind to an allosteric site on the receptor. However, their binding induces a conformational change that reduces the affinity or efficacy of the primary agonist. This decreases the receptor's response to the natural ligand without directly inhibiting the receptor's basal activity. In summary, the key differences in molecular mechanisms among these types of drugs lie in their binding sites, conformational changes they induce, and their effects on receptor activity. Agonists activate the receptor, partial agonists activate it to a lesser extent, neutral antagonists compete with agonists, inverse agonists stabilize the inactive state, positive allosteric modulators enhance agonist effects, and negative allosteric modulators dampen agonist effects. 6. Compare and contrast the different mechanisms of action of drugs that act by inhibiting enzyme activity. Answer. Certainly, let's dive deeper into the mechanisms of competitive inhibition, non-competitive inhibition, and irreversible inhibition. 1. Competitive inhibition. Mechanism. Competitive inhibitors have a structural resemblance to the substrate and compete for binding to the active site of the enzyme. Because both the substrate and the inhibitor can't occupy the active site simultaneously, increasing the substrate concentration can overcome the inhibitory effect by outcompeting the inhibitor for binding. Effect. Competitive inhibitors increase the apparent Km, Michaelis constant, of the enzyme substrate complex without affecting the maximum velocity, Vmax, of the reaction. As a result, higher substrate concentrations are required to achieve the same reaction rate in the presence of a competitive inhibitor. 2. Non-competitive inhibition. Mechanism. Non-competitive inhibitors bind to an allosteric site on the enzyme, which is distinct from the active site. This binding induces a conformational change in the enzyme structure that reduces its catalytic activity. Non-competitive inhibitors can bind to both the free enzyme and the enzyme substrate complex, affecting both substrate binding and catalysis. Effect. Non-competitive inhibitors decrease the Vmax of the reaction by reducing the number of active enzyme molecules, without significantly affecting the kilometer. The presence of non-competitive inhibitors alters the efficiency of enzyme substrate complex conversion to product. 3. Irreversible inhibition. Mechanism. Irreversible inhibitors form covalent bonds with the enzyme's functional groups, often at the active site. This results in permanent modification of the enzyme structure and activity. The enzyme can only regain its activity through the synthesis of new enzyme molecules. Effect. Irreversible inhibitors lead to a rapid loss of enzyme activity that cannot be reversed without the synthesis of new enzyme molecules. Their effects can be long-lasting and require the turnover of the enzyme population. In summary, competitive inhibitors compete with the substrate for binding at the enzyme's active site, non-competitive inhibitors bind to an allosteric site causing a structural change that reduces enzyme activity, and irreversible inhibitors covalently modify the enzyme leading to permanent loss of activity until new enzymes are synthesized. Each mechanism alters the enzyme's behavior, impacting the substrate-enzyme interaction, reaction kinetics, and overall physiological processes. 7. Identify examples of different mechanisms of action for drugs that do not fit the typical drug receptor model. Answer. The following examples illustrate how drugs achieve their effects through chemical or physical interactions with endogenous substances, leading to therapeutic outcomes without necessarily involving traditional receptor-mediated signaling pathways.
Antioxidants, example N-acetylcysteine, vitamin K. These compounds work by neutralizing harmful reactive oxygen species, ROS, in the body, helping to prevent oxidative damage to cells and tissues. They do not interact with specific receptors but instead directly interact with ROS to counter their damaging effects. Antacids, example aluminum hydroxide. Antacids work by neutralizing excess stomach acid, providing relief from symptoms of acid reflux and indigestion. They interact with stomach acid to raise the pH level and reduce acidity, without engaging specific receptors. Bile acid binding resins, example, cholestyramine. Bile acid binding resins are used to lower cholesterol levels by binding to bile acids in the intestines and preventing their reabsorption. This indirectly reduces cholesterol levels without involving traditional receptor interactions. Chelating agents, example deferoxamine. Chelating agents bind to heavy metals in the body and form stable complexes that can be excreted. They are used to treat metal poisoning. Deferoxamine, for example, chelates iron and is used in cases of iron overload. DNA damaging agents, example cisplatin, cyclophosphamide. These drugs exert their effects by causing damage to the DNA in rapidly dividing cells, such as cancer cells. The DNA damage triggers cell cycle arrest or apoptosis. They don't necessarily interact with receptors but rather induce direct chemical modifications to DNA strands. Drugs that perturb lipid membranes, example amphotericin B. Amphotericin B is an antifungal drug that works by inserting itself into fungal cell membranes and disrupting their integrity. This affects membrane permeability and leads to cell death, without a specific receptor interaction. Osmotic diuretic agents, example mannitol. Osmotic diuretics like mannitol work by increasing the osmolarity of the renal tubules, leading to increased water excretion. They do not target specific receptors but instead alter the osmotic gradient in the renal tubules. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at Coffee First Cup to receive generous discount codes.